Hello and welcome to part 3 of humerus and shoulder girdle anatomy. So let's begin our discussion with the inferior-superior axial shoulder. This is another projection that you will see frequently at clinicals, and we're going to learn this one in lab as well. And if you break down that big long word, inferior-superior axial, think about it. It means the beam is traveling from the inferior aspect to the superior aspect. An axial means that we're using a tube angle greater than 10 degrees along the long axis of the body. So this projection really provides us with a lateral view of the humeral head and neck, and it demonstrates the relationship of the humerus to the glenoid cavity, which makes up the scapulohumeral joint. So let me point that out. So we're seeing a nice lateral projection of the proximal humerus, and we're seeing the glenoid cavity here. And really what the orthopedics are looking at is this joint space, this space in between the humeral head and the glenoid fossa. So when you're performing this projection at clinicals, you have to include this joint space. Okay, they're really looking at that relationship. Now, the anatomy may appear confusing, I know, but we'll practice this in lab and you'll get the hang of it in no time. Okay, so let's just kind of orientate ourselves. So look at the model here. This is posterior, so this is the patient's back. This is anterior. This is the patient's top or ventral surface. This is the arm abducted away from the body, of course. So this way points towards the thorax or the chest. So remember, coracoid process is an anterior structure. So if you see something pointing up here, it's got to be the coracoid. And the acromion actually is posterior, so it's behind the humeral head here. See that acromion right there? Okay. All right, good. So there are 3 joints or articulations involved in the shoulder girdle. There's the sternoclavicular joint or SC joint, the acromioclavicular joint or AC joint, and the scapulohumeral or shoulder joint. So let's talk about the joints just in a little more detail. All right, so all 3 of the shoulder girdle joints are structurally classified as synovial. And then remember, synovial joints have a fibrous capsule around them containing synovial fluid. Okay, so structurally they're synovial. The functional classification of all 3 of the shoulder girdle joints is diarthroidal or freely movable. And in general, all synovial joints are typically movable, and really the only difference between these joints is their movement type. So first, let's talk about the scapulohumeral or shoulder joint. That involves the articulation, remember, between the head of the humerus and the glenoid cavity of the scapula. The movement type is a ball and socket or spheroidal joint, which allows great freedom of movement. These movements include flexion, extension, abduction, adduction, circumduction, and medial and lateral rotation. The glenoid cavity is very shallow, which we've seen on our diagrams, and that really allows for the greatest amount of mobility of any joint in the human body. It's very mobile. This is great for us, of course, but because the joint is very shallow, it's also by nature not very strong and not very stable. Very strong ligaments, tendons, and muscles actually surround the joint, and that's what helps provide the stability. Any stretching of the muscles and tendons can cause separation or dislocation of the humeral head from the glenoid cavity. And dislocations at the shoulder joint actually occur more frequently than at any other joint in the body. So that great amount of freedom of movement really comes at a sacrifice for stability. All right, the second joint that we'll discuss here is the sternoclavicular joint, and it is classified as a double plane or gliding joint because the sternal end of the clavicle articulates with the manubrium, remember the upper sternum, and the cartilage of the first rib, thus the double plane classification. So let me say that again. The clavicle articulates with the first rib and with the sternum. So that's why it's referred to as a double plane joint. There's a limited amount of gliding motion in every direction at the SC joint, and this is an elective at clinicals. The last joint in the shoulder girdle is the acromioclavicular joint. The AC joint is also a plane joint between the acromial end of the clavicle and the medial aspect of the acromion of the scapula. So let me say that one more time. The AC joint is a plane joint found between the end of the clavicle and the acromion. Okay, so this concludes our discussion of shoulder girdle anatomy. If you have any questions, please let me know, and thank you for listening.